We have a cultural obsession with the deep end of mental health. The unspoken rule seems to be that to earn a seat in a therapist office, you need a severe, lifelong psychiatric diagnosis, or you need to be scraping the absolute lowest point of human experience. But human distress rarely waits for a catastrophic breakdown. Most often, the heaviest weight comes from ordinary life transitions: packing up your life for a new city, dropping your youngest child off at college, or walking to your car after a sudden afternoon layoff. These moments trigger a strange kind of psychological imposter syndrome. Because the triggering event is common, people minimize their own pain. They tell themselves it is a passing phase, or that they don't deserve help because they aren't sick enough to occupy a professional's time. So they quiet down and endure it. And while they suffer in silence, the friction begins to wear down their daily lives. Focus at work slips away. Patience with partners evaporates, and relationship machinery breaks down. A severe, chronic diagnosis is not a prerequisite for a clinical crisis. The most frequent reason people actually enter therapy is a scientifically validated reaction to life's changes: adjustment disorder. Clinically, adjustment disorder has a precise trigger. It is diagnosed when emotional or behavioral symptoms develop within exactly 3 months of an identifiable life stressor. In primary care, these stressors are recognizable to almost everyone. It starts after a sudden divorce, a serious medical diagnosis like cancer, the loss of a loved one, or a steep financial crisis. Imagine the mind as a system with a baseline capacity, represented by 2 balanced columns: external demands and internal coping resources. When a stressor hits, demands spike, outpacing your resources. That highlighted negative space, the deficit, is the coping gap. To meet the criteria for this disorder, the emotional distress produced by this gap must be entirely out of proportion to what we would normally expect from the triggering event. Second, the gap has to cause real, tangible damage to your daily routine, significantly impairing your ability to function at work, in school, or in social environments. This means adjustment disorder is a temporary breakdown in daily functioning. It is the struggle to navigate when life's demands simply exceed your current tools. Because human psychology is highly individual, this systemic failure does not look identical in every patient. When the coping gap fractures, it breaks along specific emotional fault lines known as subtypes. The primary diagnosis splits, dominating an individual's system as depressed mood, intense anxiety, or outward conduct disturbances. These lines can also intersect, presenting as mixed disturbances of anxiety and depressed mood, or unspecified symptoms, creating a tangled web. Clinically, we define acute adjustment disorder as a state where symptoms successfully resolve in under 6 months. However, if the stressor continues past the 6-month threshold into the red zone, it is classified as persistent or chronic adjustment disorder. This illustrates the danger of simply trying to wait out the pain. Without intervention, a temporary acute gap in coping resources can solidify into a chronic impairment. The clinical advantage of adjustment disorder is its direct connection to a specific, identifiable resource gap. Because we know exactly what caused the deficit, we don't need years of continuous psychoanalysis to fix it. The condition responds exceptionally well to brief, focused methods. Treatments like cognitive behavioral therapy and targeted problem-solving therapy are designed specifically to rebuild those missing coping resources. The recovery timeline is highly efficient. In many cases, it takes only 8 to 12 sessions of therapy to completely bridge the gap and resolve the disorder. Delivering this kind of immediate, targeted care requires a specific infrastructure. Coping and Healing Counseling, or CHC, was built to facilitate these brief, evidence-based interventions for people navigating sudden life transitions. By operating 100% via telehealth, CHC provides coverage across all 159 Georgia counties. With a diverse team of licensed therapists, they accept a broad insurance matrix, meaning session costs remain between $0 and $40, including a $0 copay for Medicaid. This operational model is tailored for time-limited employee assistance program benefits, primary care referrals, and individuals navigating immediate life changes who just need a few sessions to find their footing again.
You do not have to be at rock bottom to deserve evidence-based help.
These common life transitions are a medically valid reason to talk to a licensed therapist and reclaim your footing.